رمضان طبيبي، معناك جليل بقلب جميل، يحوم النور بأنحائي، يحوم النور بأنحائي.
الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وأصحابه أجمعين. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to part 2 of the medical fiqh of fasting. Inshallah, in this segment of this series, we will be discussing juristic principles on the invalidators of fast. And what we'll like to discuss in this segment is we will explore how the ulama or the jurist arrive at their rulings regarding medication and medical interventions while fasting. We will see in this segment how ulama, in close collaboration with medical professionals, they apply principles of fiqh to arrive at these rulings, especially for contemporary medication and interventions that were not found in the past. Just to refresh, we spoke about what fasting was and what it means to be fasting. And one of the conditions, amongst others, of fasting was not to enter anything into the body. Anything that would enter the body would then break the fast. And so a very simple schematic diagram will help us understand how the ulama come to their rulings with regards to what invalidates the fast. So if we look on this very brief sketch, we have what we call a qualified cavity. This means the cavity within the body. And we will discuss what a qualified cavity is, but a qualified cavity would be something like the stomach. So anything that would reach the stomach would nullify the fast. However, in reaching the stomach, as we look on the left hand on the screen, we have a qualified agent. So whatever that was going to enter the stomach or the qualified passage needs to pass through a qualified passage. And these are the Arabic words. They are manfad al-mu'tabar. This is the qualified passage for it to reach the al-jawf al-mu'tabar, or the qualified cavity. And this has to be done through a qualified process, or al-wusul. All this has to take place without any absolving states. So if there is a presence of any of the absolving states, then this would not nullify the fast. And I'll explain to you in the next few slides. So to summarize, you have a qualified agent that will enter via a qualified passage. So it may be the mouth. It will then go to a qualified cavity, we mentioned like the stomach. And this entire process has to be a qualified process, and we'll describe what that is. And then this all must take place without there being any mani' or any absolving states for the fast to break. So firstly, what is a qualified agent? A qualified agent would be any liquid or solid. So anything liquid that we would either drink, or any solid item that we would eat or ingest. This item, either liquid or solid, and importantly, even a liquid that is vaporized would be considered a qualified agent, can either be a nutritious or a non-nutritious item. So we may eat an item that has no nutrition whatsoever, but would also be considered a qualified agent. And whether the item is an edible item or a non-edible item. For example, if someone were to chew on the nib of the pencil, which would be considered a non-edible item, this would still be a qualified agent that would nullify the fast. And finally, this substance that we would enter into the qualified cavity can either be soluble or non-soluble. So it may be something that your digestive tract may dissolve or may not. And then we have the concept of the qualified passage. So once you have the item that you were going to ingest or enter into the qualified cavity, it needs to enter through a qualified passage to get to that cavity. So this passage could be any opening on the surface of the body that communicates with the qualified cavity. So this cavity within the body, for example, the stomach, if there were anything that communicates with it, then this would be considered a qualified passage. So some of the examples we know of that are anatomical is that through the ear, and if there is a perforated eardrum, then there is a direct communication between the ear and the back of the throat and then into the stomach. Then we have the cavity of the nose. So we know that the nose, anything that enters the nose can potentially get to the back of the throat and then enter into the qualified cavity. And finally, we have the anal passage. Anything that enters through the anal passage is directly communicating with the qualified cavity, which we will discuss now. And finally, a stab wound or a surgical tract that is created that would communicate with this cavity of consequences or the qualified cavity. In medical terminology, we have something called a gastrostomy nowadays, where we are able to feed patients directly into the stomach through an incision that is made through to the skin that directly communicates with the stomach. Then we have this qualified cavity, and this is the important part, is that what is considered the internal part of the body or the qualified cavity wherein these qualified agents need to enter. And the fuqaha have gone through the hadith and Quran and have derived the qualified cavity to be the throat, the stomach, and the intestines. So anything that enters either the throat, the stomach, or the intestines would be considered entering a cavity that would nullify the fast. So in schematic diagram or anatomical scheme of what the qualified cavity looks like, from the top we can see the area called the pharynx would be the throat, all the way down the esophagus, which is the food pipe, down into the stomach and into the intestines, right down to the rectum, all will be considered the qualified cavity. And finally, we spoke about a qualified process. So this agent, which is the qualified agent, has to enter the qualified passage, but has to also undergo a qualified process. According to the Hanafi madhab, this agent or this item that is being ingested, which we call the qualified agent, once it enters into the qualified cavity, must not be seen once it enters this cavity of consequence or the qualified cavity. And secondly, it must have this concept of independent stay. The fuqaha have used the analogy of having to tie a piece of meat to a string, and that is dropped down the throat into the stomach, and it can be pulled out. So potentially that would have not gained this concept of independent stay and would not nullify the fast. This is important for modern day contemporary medical interventions that would qualify or not nullify the fast. The absolving states that we spoke about, that if found would not break the fast, is forgetfulness. If someone were to eat forgetfully, not realizing that they have been fasting, then that does not break the fast. And important that that person should continue fasting after that if they've realized they've eaten something forgetfully. The second concept of the absolving state is this concept of arduousness, where it's impossible to avoid these items entering the qualified passage and then the qualified cavity. For example, entering a room full of smoke, and you inevitably would be inhaling the smoke that would potentially, if done deliberately, would nullify the fast. Things that don't qualify as absolving states is important. If somebody has to have something out of necessity, so if somebody's blood sugar levels have dropped drastically and then they have something to bring up the sugar levels, this would be a necessity and this would break the fast. Secondly, accidentally, if someone were to ingest something, for example, if someone were to be making wudu and whilst gargling their mouth, accidentally some water goes down into the qualified cavity, then this would break the fast. The concept of coercion, that means being forced to eat something, And the fuqaha also mentioned things like eating in the state of sleeping or out of ignorance of fasting. So, Alhamdulillah, that brings us to the end of part 2 of our series. Inshallah, we will meet you at part 3 of the series on the medical fiqh of fasting. Assalamu alaikum wa rahmatullahi wa barakatuh.